Unit 16 Musculoskeletal System 3. 68. A nurse is performing a neurovascular assessment of a client with a cast on the left lower leg. The nurse notes the presence of edema in the foot below the cast. The nurse would interpret that this finding indicates 1. Impaired arterial circulation, 2. The presence of an infection, 3. Impaired venous return, 4. Arterial insufficiency. The correct answer is 3. Impaired venous return. 69. A nurse is developing a plan of care for a client with obstruction. The nurse includes in the plan of care to assess the client for which findings that would indicate a complications associated with the nerve of this type of traction. 1. Hypotension. 2. Drainage at the pin sites. 3. Redness at the pin sites. 4. Weak pedal pulses. The correct answer is 4. Weak pedal pulses. 70. A nurse is caring for a client who is going to have an arthrogram with a contrast medium. Which assessment by the nurse would be the highest priority? 1. Allergy to iodine or selfish. 2. Ability of the client to remain still during the procedure. 3. Whether the client has any remaining questions about the procedure. 4. Whether client to avoid before the procedure. The correct answer is 1. Allergy iodine or selfish. 71. A nurse has given activity guidelines to a client with chronic low back pain. The nurse evaluates that the client understood the instruction if the client states to avoid which of the following positions. 1. Lying on the side with knee and hips bent. 2. Lying prone. 3. Standing with one foot on a step or stool. 4. Sitting using the lumbar or pillow. The correct answer is 2. Lying prone. 72. A client with possible rib fracture has never had chest radiograph. The nurse would plan to tell the client which of the following items about the procedure. 1. The X-ray stimulates a small amount of pain. 2. It is necessary to remove jewelry and any other metal objects. 3. A client will be asked to breathe in and out as the radiography is taken. 4. The X-ray technologies will stand next to the client during the procedure. The correct answer is 2. It is necessary to remove jewelry and any other metal objects. 73. A nurse is caring for a client in skeletal traction. The nurse is assessing the pin sites and notes the presence of pool and drainage. Which nursing actions would be most appropriate? 1. Document the findings. 2. Clean the pin sites more frequently than prescribed. 3. Apply antibiotic and mend the pin sites. 4. Notify the physician. The correct answer is 4. Notify the physician. 74. A nurse is assigned for care of a client who is in traction. The nurse prepares a plan of care for the client and includes which nursing action in the plan? 1. Monitoring the weights to be sure that they are resting on firm surface. 2. Checking the weights to be sure that they are off of the floor. 3. Making sure that the knots are at the place. 4. Making sure that the head of the bed is kept 45 to 90 degree angle. The correct answer is 2. Checking the weights to be sure that they are off of the floor.